Matthew Holt here at Health 2.0. Again, celebrating winners and finalists in the two different competitions that funded by the Robert Johnson Foundation. And this one is Cloud Cray. Cloud is the CEO and founder and CEO of Patient Price. Patient Price came third in the AI for Consumer competition, and you're a pretty new company. So tell us a bit about what Patient Price does.
Sure. So we're a marketplace-style application. We help patients compare providers with cost, quality, and convenience. We show everybody in the state of Massachusetts for any procedure, and we will actually let that patient know what they're likely to pay out of pocket before they go to that provider, and we can even help them schedule their appointments online.
So talk a bit about the AI component, because you did win a prize in the AI competition. What's the what was there that is different and unusual compared to some of the pricing engines we've seen out there before?
Right. So many of the pricing engines out there just use traditional averages and stuff like that, some traditional statistics. We use AI in the background to actually find out what is the most likely price down to the penny that that patient is likely to owe out of pocket. And we can also adjust for provider preferences and stuff like that. Whereas, this guy might do a 45-minute visit, that one might do an hour or something like that. We normalize that so patients don't have to become medical billing experts before they can participate. And we combine that also with quality data and some convenience data so we can give that more consumer-like experience that you don't really see in healthcare in those other platforms.
Yeah, I think there's been a lot of interest in these transparency platforms. They haven't really sort of gone the final mile, and that seems to be the problem you're hitting at. So tell me a bit about your development so far.
Right. So we are a very early stage company. We are pre-revenue. However, we are the first for-profit consumer-facing application to have access to Massachusetts All Payers Claim Database.
So tell me, stop there for a second. How did that work?
Right. Well, Massachusetts has some great pricing transparency laws, and they've taken a couple initiatives, as well as a few other states, to really bring pricing transparency to healthcare. Now, that's not really its own space. That's just one piece of the puzzle. But we were the first ones to actually be, to apply for that data and be a startup that actually was able to access it. We have access to over 160 million procedures, and that's how we actually can find out what providers are actually getting paid for their procedures. We can combine that with patients' real-time insurance policy information and give them a good sense of what they're likely to pay.
Interesting. I talked a lot this morning about getting data and data analytics and real-world evidence all together in one place. And if you caught that part, but obviously a part of that is getting data analytics into the world of breaking down different data silos. You talked about your pricing mechanism. You talked about insurance data. What else? What other data sources are you pulling in, and which ones are easy and which ones are hard?
Oh, there are so many challenges we had to solve here. Things like provider directories, they move around, they moonlight. Making sure that we understand not only the procedures, but how they all fit together in individual visits. Some places you'll do all the tests in one go, other times you have to come back for your radiology and your lab work and stuff like that. Making sure that we can all tie this together and map it, and then ultimately use the AI so we can break that down into something that patients can really understand, so they don't have to know all that medical terminology before they make an informed decision.
Yeah, fascinating problem. I really enjoyed seeing your demo yesterday. You've obviously we've got a hell of a long way to go to fix this part of healthcare. We were just talking with some others about opiate problems, and this is a big intractable problem. There are public companies like Casta and others who are having a crack at it, but haven't really got there, to be fair, in some areas. You're early stage. Tell me a bit about your funding and where you think you're going from here.
Sure. So we raised about $400,000 to date. Largely that was for purchasing data and some of our initial engineering. We're actually preparing to launch here in Q4 of this year. We're reviewing with the state of Massachusetts. They've been very helpful with us. We are the first startup to work with this data before. We would like to actually find some more investment to help us have a really successful launch there. And we're also looking for partnerships on the payer and provider side to make sure we're bringing that value to those parties as well. We really need to include patients, providers, and payers all in that conversation so we can bring that value to everybody.
Fantastic. So what do you think about the competition you're in? Because you're really early stage. You were up against the winner, Bowie Health, has already raised $9 million and sort of several million users. I think how many, 30 or 40 million users. So quite an interesting sort of juxtaposition between the really early stage and the slightly later stage. So what was the experience for you like?
Well, it was exciting, especially because Bowie's also another Boston-based startup, so it was good to run into them here as well. It was an excellent opportunity. I believe over 200 companies applied originally for this competition, so to get in the top 3 was very exciting. To get that chance to also talk in front of everybody else was great. I've had a lot of wonderful feedback. We've actually solved a lot of problems in the background that other people have experienced with provider directories and processing claims data, and I think we're actually seeing some of that value in those conversations going forward with some potential momentum there as well. If nothing else, we were just really excited to be here and get a chance to present and talk about the solution.
No, very exciting. There's a long way to go in this area, but you do some really great work. So I've been talking with Cloud Cray. He's the CEO and founder of Patient Price. This is Matthew Holt signing off from the Health 2.0 conference, where we've been talking about the Robert Wood Johnson Foundation's AI for Consumer Challenge. Thanks, Cloud.
Thank you so much.